Welcome, everyone. I know we still have individuals still joining us as they continue to jump in. We're going to go ahead and get started. Want to give everyone an ample amount of time to be able to ask their questions and to also be able to hear the presentation. Hi, I'm Stacey Davidson, and I'm a program manager with BAC HAC, and I will be your facilitator for this breakout session. I want to take an opportunity to just go over a few meeting guidelines for tonight's dialogue. One, we ask that you be engaged, be curious and open. Challenge ideas, but don't challenge the person. Seek to understand, stretch yourself, speak your truths, and respect others' truths. Please put your questions in the chat box, and as our panelists finish with their presentation, during the question and answer time, we'll give them an opportunity to answer your questions. At this time, I will turn it over to Srija, and she will go on with our presentation.
Good evening, everybody. Really nice to see you all. And for those of you who I haven't met, I'm Srija Srinivasan, and I'm Deputy Chief of San Mateo County Health, your public health department for San Mateo County. And I think we could go ahead to the first slide, Mark. I have been a public health professional for most of my career, which is around 25 years, and with the county health department in several roles for the past 16. Of all of those, of my life, you know, this year has been the most challenging and humbling. So being in a space with people who really care about our residents, joined by stellar panelists who you'll meet in just a few minutes, is a super honor. And I appreciate the opportunity that Andre and the Unity Care colleagues created for us to spend some time together. Next slide, please. And we could go ahead and go to the first one. In San Mateo County, we are hopeful that the worst may be behind us, but we are also in a mode of, you know, just continued vigilance that we've held on to for so long, these many months, having just reflected on the 1-year mark of the shelter-in-place order. The toll of this pandemic has been brutal. The last few months have been especially challenging. And knowing that we have lost 544 residents in this period of time is just really, really sobering. Most of the impact of the disease has not been borne equitably, as Dr. Burke-Harris was pointing out, and as you all well know. Our most impacted communities are ones that had pre-existing conditions of shouldering inequities. Our lowest income residents, those who are performing essential work that didn't have the privilege of working from home, those who have kept us fed, kept medications delivered to our doorstep, our healthcare workers who've been so heroic on the front line, and the impacts of structural racism that have already left people of color in a more vulnerable place have really been exposed in this pandemic. And we want to keep learning how we can close the gaps that have gotten wider, sadly, as we come to a more hopeful place with the vaccine rollout that's the focus for the time we're spending together today. And we could go to the next slide, Mark. In San Mateo County, we keep reminding ourselves that eventually there will be enough vaccine for everyone in San Mateo County, but have needed to really stay true to the state's prioritization process that's baked in science. It's such a privilege to have someone like Dr. Burke-Harris as our Surgeon General in California, so that along with safety, that's absolutely at the core of the vaccine rollout from every level of government, we have transparency in what do people need to know about the vaccine? What questions remain unanswered? What can we do to build trust and confidence in 3 vaccines that have been available in a quite short amount of time? And working with an equity lens to mitigate these pressures on the widening disparities that our communities have shouldered. It's been super important in San Mateo County to try to have speed along with equity for a few key reasons. First and foremost, protecting our most vulnerable, our older adults who have been isolated the longest and have had the greatest fatality risk, our healthcare workers, people who have been living in close quarters, needing to earn continued vaccine supply. So even though we're all in this together, having enough vaccine while there isn't quite enough for the demand has required us to demonstrate speed so that we as a county continue to roll out as fast as possible. And then also mitigating the variant strains that some of you may be reading about and hearing about in the media. Our best protection to get to a better next phase is getting ahead of the variants and having a more protected resident community. Next slide, please. I think many of you know, next slide, please, who's been eligible so far in San Mateo County. And I learned along with many of you, and Lisa and I were actually in a meeting together with some of you, that soon everyone in California will be eligible to be vaccinated. By April 15th, that will include every Californian age 16 or older, as the governor announced today. By April 1st, it will include anybody age 50 or older. Until then, the eligible groups are listed on this slide with an estimate of how many San Mateo County residents that represents. We've been working to achieve reach across each of these groups, but the group that became eligible most recently, adults with underlying medical conditions, just a little over a week ago, became eligible at a time when supply was still pretty constrained. So we know we haven't reached all the folks that have been eligible so far. And we know that that's been frustrating. And the pathways to find a vaccine have made people travel long distances, overcome lots of different registration challenges, figure out transportation, all while trying to keep protecting ourselves and our loved ones so that we can, get to a better next normal. Next slide, please. I don't think I need to tell all of you what the New York Times relayed, a couple of weeks ago in this March 5th headline, that the disparities that we've seen in the virus's impact have also shown up in the way the vaccine reach has been achieved. The residents who have shouldered the most are also the ones that don't have the time to be looking at 17 websites to click on the appointment that shows up on an online registration portal. In San Mateo County, as of today, the slide screenshots were taken about a week ago. We've vaccinated almost 250,000 residents, 248,006 as of March 23rd. That represents almost 39% of residents age 16 or older. And with our older adults, we've vaccinated 80%. So we've really made great strides with the populations that have been eligible the longest. When we look into who hasn't been reached, we ask ourselves and check ourselves and hold ourselves accountable, looking by every dimension: age, gender, race, ethnicity, geography. And what we see are the communities in the lowest quartile of risk, the least protected, the most exposed, are not at the 39% reached yet. They're about 8 percentage points behind. So most of our focus in these few weeks, while vaccine supply is constrained, is how can we be taking the vaccine to the communities that have shouldered the most? How can we be working shoulder to shoulder with community partners that have deep trust to build confidence in the vaccine pathways that are available? How do we keep closing the gap to keep hope and resilience in our communities that have shouldered so much? I think we'll have lots of times for questions, and we heard that you all have questions. So I want to turn the baton to Dr. Sims, my colleague, who I'm so pleased has joined us this evening.
Thank you very much, Srija. My name is Dr. Leroy Sims. It is truly a pleasure to be here with you all this evening. I hail from Chicago, but I've been in California since '97, so I am Californian. I've been in San Mateo since 2010. I practice at Mills Peninsula Medical Center in the emergency department. I also hold a position as Senior Vice President and Head of Medical Affairs for the National Basketball Association. Next slide, please. I wanted to take some time this evening to talk to you about my journey with the vaccine, because I think it probably mirrors a lot of journeys that people are on right now. I spent my summer working in Orlando in the NBA bubble, making sure that we were able to successfully restart our season and keep our players and our staff healthy and safe. When I got back in November, I got an email from Sutter saying that we were going to start vaccinations in December. And I was like, what? I don't know about that. In fact, I drafted an email that is still in my inbox saved, that I sent to the hospital that said I was going to defer, that I wasn't sure that I wanted to get vaccinated in December. The reason was because I had questions, I was hesitant, I had doubts. I wanted to see the data. I wanted to see who was included in the clinical trials. Was there diversity? What were the results? I needed to see that data for myself. And then after that, those studies were published from Pfizer and Moderna, I needed to ask questions of experts in infectious disease, epidemiology, statistics. Only after I got my questions answered and I poured over the data that I started to feel more comfortable with the idea of getting vaccinated. And to that end, I did get my first shot on December 18th. I got Pfizer. I did feel tired. I felt achy. My arm was sore, but my symptoms lasted for less than a day. And I got my second shot on January 18th. Since that time, I've been on a campaign to promote vaccine education, to make sure that I'm reaching a very broad group, a broad reach. Part of my task at work was to present on the vaccine to every single NBA team. I went team by team over Zoom for 30 minutes, 30 times 30. But then I also gave the presentation to my family one Sunday after church. And I talk about that in detail in an interview I did with Mark Spears for The Undefeated. And I talked about how my uncle, who's probably one of the biggest skeptics I know on almost everything in general, after hearing my presentation, after answering his questions, going through commonly held myths that people have, like this process was rushed, the vaccine is going to alter my genetics, that there was no diversity in the clinical trials, the results, how do we know if they're good or they're bogus, so on and so forth. I just went point by point addressing those myths and misinformation. And at the conclusion of that, he said he was on board. Can I have the next slide? I count that as a victory, having convinced my uncle, but also just reaching to my family, reaching out to the community now. I had a conversation with San Mateo County Health in January. I've given a similar presentation to my own church family back in Chicago, to my mom's church family in Florida. I want to make sure that people have access to credible information and that their questions get answered, and that's why I'm here tonight. What we know about this pandemic is this, that health and racial inequities and disparities that have long existed are being highlighted by this pandemic. The impact is being bared by our communities of color. Look at the Black community, the Latinx community. All of these things are being highlighted here. We see higher rates of COVID. We see not just higher rates of COVID, we see higher hospitalizations, and we see higher levels of death. All of those things as a result of COVID. And so what we cannot afford to have happen is the people who need the vaccine the most, the people, look at this graph, look at these demographics, that's exactly where we need to be focusing our attention to make sure. Now, people will point to this hesitancy thing. Well, Black people are hesitant to get the vaccine. It's not just Black people who are hesitant to get the vaccine. There are a lot of non-Black people who are hesitant to get the vaccine as well. So let's make sure that we're having a genuine conversation and a genuine dialogue about where we are in terms of hesitancy. And let's not forget that hesitancy that Black people have, that's built on a history of decades and centuries of mistrust, of abuse from the medical system, experimentation on Black bodies, exclusion from treatments. And it's not just a history, it's a now story. Think about what happened with Dr. Susan Moore, a Black female physician who knows the medical system and had issues advocating for herself in the process of being diagnosed with COVID. Think about times when you go to the hospital and you don't get the care that you need, that your chest pain is dismissed, that your pain is treated with Tylenol and Advil instead of something stronger, and you go home and you have to ache at night. That is why people in the Black community are going, so now I'm supposed to all of a sudden trust the medical community. So the message is important that we're sending, but also the messengers. And that's why I wanted to make sure I use my platform and my position as a medical professional to reach out to my people to speak the language to answer the questions. Next slide, please. We know that these vaccines are safe and that they are effective, but we have also seen throughout time that through vaccination, we've been able to make a lot of progress in illnesses and diseases that are inflicting us. Think about the vaccines that we have through childhood: measles, mumps, and rubella vaccine, the chickenpox vaccine, or vaccines that our parents are getting or we're getting as we age, the shingles vaccine, the pneumonia vaccine. We have an experience with vaccination, and I have to be honest with you, I don't run into a lot of people who are anti-vaxxers because we have such a large data set of so much information about vaccines and how they work. We've eradicated polio. We've gotten rid of smallpox. We've done a great job with measles. And this is another opportunity for the medical community to make a difference as it relates to this COVID pandemic and this virus. We know that vaccines work. Some vaccines, they give you lifetime immunity. Some vaccines, you need a booster every 10 years. Some you need every year. It remains to be seen what's going to happen with this situation, and COVID really is dependent on how fast we get people vaccinated. The more people we get vaccinated, the fewer people who are susceptible for the coronavirus to impact. What we're trying to get to is what's called herd immunity. And herd immunity is somewhat of a byproduct of the whole vaccination process. But look at just this slide, the different type of vaccines that are in development. I can tell you this as my last point before turning it over to Lisa. We have seen these vaccines on this slide get approved with anywhere from a couple thousand to maybe 10,000 people enrolled in the clinical trials. For the COVID vaccines, Pfizer had over 40,000 people enrolled. Moderna had over 30,000 people enrolled. Johnson & Johnson had over 40,000 people enrolled. We have never had this amount of participation in a clinical trial. Clinical trials that are being led by people like Dr. Kiznikia Corbett, a Black female scientist at Moderna, more physicians of color helping to guide clinical trials, more people of color participating. We're at a unique point. The reason we were able to get these vaccines developed in such short order was billions of dollars spent with lots and lots of collaboration from around the world and lots of participation from people that we have never seen before. The process wasn't rushed by any means. mRNA technology goes back to 1989. That's when the first scientific study was published on RNA research. So this isn't new technology. This isn't a new virus that we're experiencing. We experienced the SARS outbreak in 2002, which was a coronavirus. We experienced MERS in 2012, which was a coronavirus. This is the third outbreak that we're experiencing. So we have experience with this virus. We have experience, knowledge, and data with this technology. And through a massive collaboration, we were able to get to the point where we are today. My recommendation and my strong encouragement is that you get vaccinated. The question will always be which vaccine. Get the one that's available. My family is an equal opportunity vaccine receiving family. I received Pfizer, my wife received Moderna, and my dad last weekend got Johnson & Johnson, and I support all three of those. Thank you all so much, and I will turn it over to Lisa.
Thank you, Dr. Sims, and thank you, Srija, for those great presentations. I was having some technical difficulties, so I don't have the same background as them, but we're not going to let one laptop stop this show. My name is Lisa Tealer. I am the Executive Director of the Bay Area Community Health Advisory Council, BACHAC for short. Pronouns are she and her. I am humbly honored to be the Executive Director for the last 3 years. Prior to that, I spent 30+ years in the biotech industry, both at the bench as well as in the diversity and inclusion space. Mark, next slide, please. Next one. So just briefly, a little bit about BACHAC. Part of my presentation is to talk about the role of the community-based organization. This organization has been around for 25 years. It's a grassroots organization started by a group of African-American concerned citizens in San Mateo County to address health disparities across various diverse communities and across generations. They've been doing this work around advocacy, through education and awareness, and always in partnership and collaboration. This group has been amazing with the partnerships that they've developed, from nonprofits to government agencies, corporations, academic institutions, and of course, always doing that in a culture of equity, inclusion, and innovation. Next slide, please. So as our role as a community-based organization is, as I mentioned before, to serve the needs of the community. In this particular case, talking about COVID-19 and providing vaccine education to our underserved communities to increase access to testing and to the vaccine. And on top of that, continue to do our other work, programs and services that we offer. How do we do that? We do that through, as I mentioned, education. When the pandemic started, we had to pivot because a lot of community work is done in person. And we started an educational series called Wellness Where You Are series, so that folks could access information online. Although there are limitations with that, because we know a lot of our communities don't have access to computers. And so we were also able to use the Zoom function where people could actually call in and get that information. We've had about 13 or 14 of these since the pandemic started on a variety of different topics. We also started doing phone banking, and we learned from our work doing the census education and engagement work, as well as our voter education and engagement work, that providing information over the phone and literally calling community members on the phone, providing them with information, answering their questions, or directing them to services has been a big help, and we've continued to do that day in and day out. Of course, providing some email blasts with information. Again, we've upped our game around social media, so Instagram, Facebook, Twitter, and LinkedIn. Shout out to my staff who's done amazing work around this area. And then of course, being representatives on panels like this one, on committees. Srija and I see each other via Zoom several times a week in various meetings, and also with our colleagues from the county, as well as our colleagues that are part of CBOs as well. Next slide, please. We also provide weekly COVID testing. This is a collaboration between St. James AME Church in San Mateo, as well as the College of San Mateo's nursing program. The nursing students there are awesome. This is a way for them to get their requirements met for their degree, as well as with the county providing the actual tests. And then we also give out free PPE. So gloves, masks, and sanitizer, and that's every week on Wednesday. We did a small pilot of community vaccination clinic with a Dignity Health affiliate, Sequoia Hospital. And so that was very successful. And so we're hoping that we'll have an opportunity to do more vaccine clinics in the future. I think one of the greatest things is the collaboration with other CBOs, the county and healthcare organizations. I know a number of you are listening in, and I want to thank all of you for partnering and collaborating with us. And then of course we had to modify our existing programs and services. Now, what is not listed on this slide is that CBOs really serve as the canaries in the coal mine. We can tell you what's going to work and what's not going to work in our community. And we have the pulse of the community. We are trusted messengers. So we are able to utilize our reputational capital and the relationships that we have with community members to relay information. Next slide, please. So what are we experiencing? Some of the challenges and opportunities there are the ever challenging eligibility criteria that Srija just mentioned. It's like every day, it's something different almost. And so it's been very challenging. And I'm speaking to the choir because I know all of you are experiencing that as well. So we're constantly trying to shift and provide information. You know, the minute you update the website, the criteria has changed. Now, the good thing, as Dr. Burke Harris had mentioned, is that the eligibility criteria is now expanding. And so hopefully in the next month and a half, everyone will be eligible and everyone will have access to the vaccine. Now, dealing with the supply of the vaccine is a separate issue. A confusion on where to get the latest information. We have a hub on our website to links to other reputable sites. So like the county website, the California Public Health website, CDC, and others. But there has been, again, the digital divide can bring challenges there because we have folks that don't have computers, don't have access to the Wi-Fi. They may not be able to get the latest information and get it in a timely fashion. Again, as I mentioned, our seniors, our low income, our people with disabilities are experiencing these barriers as well. And then on top of that, as we all know, CBOs work on very lean budgets. And so battling fatigue and burnout from COVID and just, you know, managing the day-to-day along with our other work, trying to raise funds, keeping the doors open, keeping staff has been one of the greatest challenges. We lost some of our funding last year. Luckily, we were able to get some of it, but you know, money is always an issue. So, and you know, the CBOs are also just a reflection of the community as well. So whatever the community is experiencing, we're experiencing as well. Now, on the other side of the coin, though, is again, the opportunities to collaborate with other organizations and individuals has been amazing. And there are just a number of individuals, several of you are on this call, and organizations that we've partnered with, we've worked with, we've cried together, talked together, and that has really been a blessing to be able to get best practices, get the support, just get a fresh face or just somebody to talk to has been amazing. And access to leadership that we may have not had in the past has also been an opportunity for them to hear directly from our folks who are on the streets canvassing and know these communities, for them to have a direct line to those individuals, and that's really critical. An opportunity in this sense is further highlights the community's issues around health disparities. I mean, it can be an opportunity and a challenge, but as we know, health disparities have been here for a while, and that COVID has just highlighted those disparities even more so. So hopefully with that being bubbled up to the surface, we will get more attention and more resources and really deal with the structural and institutional racism that we face. And we've seen that highlighted in this past year. One of the other things is the can-do spirit that CBOs have in trying to come up with solutions. We're used to being scrappy. We're used to, like, if you can't get over something, you go under, sideways, crisscross, hopscotch, whatever you need to do. That's what we need. That's what we're doing. And I think CBOs have highlighted that can-do spirit in spite of all the challenges and barriers that we face. Next slide, please. So again, I am with that. If you want to know more about BACHSA, feel free to go to the website. And I want to thank again Srija and Dr. Sims, as well as our facilitator, Stacey, for this opportunity. And I will send it back over to Stacey. Thank you.
Thank you, Lisa. Thank you all for who put their questions in the Q&A section. I do see that some were answered, and hopefully it was, if it was a direct, I will click. They were directly sent to those individuals who asked the question, but I will briefly go over two of those, just so, a couple of those so you all can hear. There was a question: I look forward to addressing the employer's distribution of the vaccine for San Mateo County employers and what the access is proposed to look like. Srija, do you want to answer that again, just to give it everyone an opportunity?
Sure, no problem. So our expectation is that the vaccine will transition from being administered by the county to local healthcare providers to the administrator contracted by the state, Blue Shield of California, and that they will be able to distribute the vaccine to entities registered in the state's MyCalvax system. So probably not directly to employers unless they're healthcare entities. Some of those entities are exploring partnerships with major employers in case they could bring vaccines on site to an employer campus or a parking lot and the like. We do think this is going to evolve quite a bit because it's been so supply constrained, and things will evolve quickly in San Mateo County given the employer base we have.
Great, thank you. The next question was, the state of California's website, My Turn, has not been readily accessible for our county. Can you please provide the county's website where people can contact to assist in getting vaccine appointments?
I did put that in the chat, so hope folks have an opportunity to see that. If you Google COVID vaccine San Mateo County, you also will be directed to our site. At this phase, we recommend that residents sign up for both our local notify tool as well as the state's My Turn, so that we have information to get you to a pathway. The Bay Area counties are the last phase to be onboarded to My Turn. So local appointments won't show up in My Turn until our county and our colleague Bay Area counties are onboarded.
Perfect. Thank you, Srija. One other question directed to you is, how soon will the Johnson & Johnson vaccine be available as the other two vaccines are? And can I choose the vaccine that I want?
Yeah, we've received a total of 3,200 doses of the J&J vaccine, so pretty small quantity. And we're told that it would be a couple weeks pause before more came our way. There is a supply production issue that's being overcome at the federal level. Typically in the vaccine clinics we arrange, the county arranges, we only offer one vaccine, and that's to focus quality management on not, no confusion of what's being drawn, how long can it be out, et cetera. I believe some of the major healthcare entities, Sutter and Kaiser, do offer a choice on location. For us. In preserving scarce resources, we do not offer a choice. We do inform residents what vaccine we're using, should they not want to sign up or participate at that time.
Thank you again. Good evening, honored panelists. My name is Marion with BAC-HAC. How long does the full vaccination last? And I've heard that after both doses, you are protected for 6 months, and then you will have to have a booster shot. Dr. Sims, would you like to address that, please?
Yes, and I did respond to that one in the chat. So first of all, you have to understand how we're tracking people's response to vaccination and to COVID infections. So we're looking at antibody levels. When you get infected with COVID or when you get the vaccine, this triggers an immune response. What your body responds to from the virus or from the vaccine is in part the spike protein that's on the outside of the coronavirus, which is where the name corona comes from, that crown-like protein. Your body makes antibodies to that. That immune system response is turned on by your T cells. So I'm going to give you a little bit of immunology here. So your helper T cells, they stimulate your B cells, which makes antibodies, neutralizing antibodies against that spike protein. But the helper T cells also turn on your killer T cells, and the function of the killer T cells is to kill anything that's foreign, to kill the cell. So when your T cells, your killer T cells, CD8 cells, see that spike protein, it recognizes it as foreign and it kills the cell that has the spike protein. So during the trials, they measured the antibody level of people who were vaccinated. And we also do the same for people who get COVID to see if they've recovered, see if they're making antibodies. For people who get infected with COVID, your antibody production and your antibody levels start to drop anywhere between 3 and 6 months, and it varies by person. What we've seen is that people who get vaccinated, their antibody levels are at least 10 times higher than people who have had natural infection with COVID. So that suggests that you have not only a higher response, but a longer duration of response. It's only been a year since Pfizer started testing their vaccine. So we have a year's worth of data. And so we're looking, and it seems that these vaccines are protective for probably that long. But there was a recent study that actually just looked at people who were inoculated with the Spanish flu in 1918. And some of those individuals still have antibodies. So we can't say for sure exactly how long, because we need more time to get that data. But we are seeing that there is a high degree of protection from vaccination, again, longer than what you would get if you got naturally infected with COVID.
Thank you, Dr. Sims.
You're welcome.
There is a question. Is it residents only eligible, or residents and employees eligible for vaccines?
For each of the essential worker categories, if you live or work in San Mateo County, you'd be eligible to be vaccinated in our county. For older adults, the population that's based on age, it's for San Mateo County residents.
Thank you. Dr. Sims, there was a question that was asked, and yes, you did address it in the chat, but I would like, if you don't mind speaking of it again. For the anti-vaxxers, do we need a presentation like the one you presented to your friends in church, or is it something more targeted? I've heard anti-vax sentiments across different ethnic and racial groups.
Yes. So you have to understand the audience. You know, it's always, I say the audience, you have to understand what it is I call it AIM. Whenever I'm going to give a presentation, the AIM is what I address. Number one, audience. Number two, the intent. What am I trying to get across? And then only once I understand the audience and the intent, it could also be their intentions, do I develop the message. So what's my aim? What's your aim when you're talking anti-vaxxers? Some anti-vaxxers simply don't want to hear scientific data. They don't want to accept medical evidence. And so if you enter a conversation where someone is not going to accept what you're saying, no matter what, it's not going to be very, very productive. You have to see if you can engage in dialogue and get to a sense of understanding why. I can tell you this, one of our teams at the NBA, they had someone who was kind of anti-vaxxers. And when I got down to talking to this individual, he said, my child has a developmental problem. And I think it's because of vaccines. And then we start talking about, well, what about your other child who got vaccinated? And what about this degree of people, all this data we have that show that there's really no association. And we had a discussion. I didn't say, no, you're wrong. These vaccines work. You're crazy. No. You have to understand where he's coming from. His hesitation has everything to do with a personal experience. And a lot of times people are coming to you from that point. So we may not be able to sway anti-vaxxers if they're rooted so firmly in a particular ideology, but if you can have a neutral conversation and start to understand, and then you can see, hey, maybe you can change their mind or sway them. But the goal in my conversations with anti-vaxxers is not to go, I'm going to change your mind. It's to let me understand where you're coming from. Let me give you the information, and hopefully that helps. And it's the same thing with this vaccine. I want to give you credible information. I want to dispel myths. I want to answer your questions so that you can make an informed decision. That's the whole goal. It's not at the end of this, hey, go in the next room and I'm gonna stick a needle in your arm. It's all about communication and that interaction. It's almost like a dance that you have to do.
Thank you. There is one other question for you, Dr. Sims, and I know you did answer this one again. It's how can we get presentations like the one you did with your family and church in our local communities in different languages?
So I don't know if the conversation I had with Shireen with San Mateo County Health was translated, but we had a discussion about the vaccine and community hesitancy, and that's available online. There's an abundance of information that is online, is being translated. There's several societies that are going to that end. I dropped a link in the chat. Bishop T.D. Jakes had a Conversations with America where he had on Dr. Kizzy Corbett and he had on Dr. Fauci. That was there. Tyler Perry did a similar presentation on the vaccine. So there are definitely resources that are out there. and I'm here today. Part of it is I'm here today to talk about the vaccine, to answer questions, and hopefully, people are tuning into this session, tuning into the broader session that Dr. Harris gave earlier today. But we try to get these resources out there, and hopefully we're getting some penetration.
Thank you. Thank you for that. Well, we do not have any other questions in the links. Is there anything you all would like to close out with as we continue on for the remainder of this presentation?
I want to just give a lot of gratitude, and I want to acknowledge Nicole Taylor is in our room, and she was on the video as one of the key sponsors of this evening's event. Thank you, Nicole, for being here and for all of your support of this important work. One of the greatest privileges of doing this work in San Mateo County is just how people come together when things are hard, how we make new friends and honor each other as colleagues and partners. And I just have a lot of gratitude to each of you for taking this time and, helping us, being extenders of the public health workforce that's trying to stay striding with you as we protect our most vulnerable residents.
Hi, this is Lisa. I want to just thank everyone, Stacey, Mark, our technical support, and all of you, Dr. Sims, Srija. And as Srija also mentioned, but I also wanted to say is that I'm very grateful to everyone. And that part of us working together means to have those uncomfortable conversations. And that we may be, get a little antsy, a little upset, but that's because we care. And that we want to make sure that our community is being served. So even when we're going through the tough times with each other, the main thing is we're trying to help the community. And I hope that people can hear that, and that we make ourselves available for any other questions or comments that you might have in the future. So thank you.
And I would just like to conclude by saying what's most important is information. Make sure that the information that you are getting is credible. Make sure that you're getting accurate information. There is so much misinformation, so many myths, so much false information that's out there, and it gets amplified on social media and online. So just make sure you're going to reputable sources, getting information from people who you trust so that you can make informed decisions and you can let people who you know and love get that information to make informed decisions. I'm going to continue working with Lisa and BAH CAC, Bay Area Health Community Advisory Council. It's easier for me to say that than the initials, but it's super important that we continue to have these conversations. I'm trying the best of my ability to try to avail myself. I work in the ER. I work with the NBA full time. I'm a husband, a doctor, a father of two, 9 and 5. And so to the extent that I can be available, I want to make myself available. And again, I'll work with Lisa to see how I can get some information out there. I did the session I did with my church, we recorded it on Facebook. Now, granted, it was a month ago and I didn't have Johnson & Johnson information, so it might be a little outdated, but maybe that just means we need to do an updated session. Perhaps I can record something. I'll see what we can do to make sure we can get that information disseminated. But in the meantime, there's just a plethora of information online. Hopefully you can find some of that. Thank you all so much for being here and your time and for allowing me to be a part of this. I really appreciate it.
Thank you. Let me say thank you to both Srija, Dr. Sims, and Lisa for your taking the time to give us this information. It was a wealth of knowledge. I know there were many notes that I was taking here while I was listening to each of you. So we appreciate you taking your time out. At this time, I want to remind everyone, we will be jumping back into the main session. And so we will drop a link for you to click on to drop back into the main session. And we thank you for joining us in our community breakout room, and we will see you in the main section. Thank you. Have people left out, Mark?
Yep, I think there's only 6 more people left.
Okay. Just checking to see. I'm not sure if they can hear us. Just making sure.
Yeah, they're slowly dwindling down. I think I might send this to them.
Let's put the link back in one more time.
Yeah.
Yep, better safe than sorry, right?
Exactly. I'm actually gonna send it to them personally too. So they have that. To your house. Yeah, I think this session went pretty well.
Okay, I think so too. I was gonna ask you, what'd you think?
Yeah, there was so much information. I mean, a lot of stuff that I personally didn't know, you know, being like on the east side, but I definitely think this was valuable, and a lot of people asked good questions as well. So we were having a good Q&A session, which
I think so. And although they answered the panelists answered the questions, I wanted them to be able to verbally say the question back to the person because I felt like that would, even though you get it in the chat, it still feels more personable when we ask a general question and then everybody's able to answer it. And Dr. Sims is a wealth of knowledge, is he not?
Yeah, honestly, he was dropping gems. I was, I mean, I just didn't know that much.
Yeah.
I feel pretty naive at this point.
Oh, Marion can't get in. If she just clicks on it, if she drops it in her browser and clicks on it, it should let her go back.
Okay, that's odd.
Yeah, because she should be able to just click on it. Oh, I wonder if Marion can hear me.
I think she can. Let me see, drop it again. I'm trying.
Because I see that I can just click on it and then it will take me back to it'll say, do you want to join into the next link is what it says. And you just say yes, and it brings you back.
I wish I had the opportunity to like send people, you know.
Yeah. And the other thing was, I know that they said they were supposed to send us a 10-minute. I never received that. Did you get that?
Yeah, I didn't receive that either.
I just looked at the time and I was like, yeah, we need to go back. So with that being said, Mark, I'm going to keep your number. I do have family, like my uncle actually just passed away from Silver Springs, and he was 96, so he lived a wonderful life. He went to 12th Street Church in Washington, D.C.
Okay.
And so but he was I believe, I think they just finished his services. He was a Black colonel, not very many colonels in the Army.
Really?
Yes, and extremely involved within Kappa Alpha Psi Fraternity Incorporated.
Really?
Yes.
So I actually, when I was in high school, I was in a program called Kappa League.
You might know my uncle. His name is.
I was in the Silver Spring chapter.
You probably know. His name is Vandy Miller.
Vandy Miller?
Yes.
That's your uncle?
That's my uncle.
Yeah, I'm pretty sure. So I was with a group of, I think, 7 of Kappa Alpha Psi fraternity members who were in that chapter. And I remember them speaking of a couple of people who were older, and I remember that name coming up. I don't think I got that opportunity to meet him, but yeah, this is a small chapter, but I was there for about 2.5 years.
Yes.
So I went to college. It was awesome.
Wow. See how small world that is? So you have my number. I have yours. Let's stay in contact.
And I sent you a LinkedIn request as well.
Okay. I will accept you and do all of that.
Awesome.
All right.
Thank you again, Stacey.
You're welcome. It was a pleasure. All right. Bye-bye. Now it won't let me click. Okay, there. I was like, it won't let me click. I'm like, I need to click. Oh, I know what I did. I went into my I did like she did. I had to open a browser and then drop it in.
Copy it over.
Which I don't know why.
There's one more person here. I'm not sure who it is. Sending the message again.
Yeah, you have to open another browser and then go in, but it still lets you go.
Okay.
All right.
All right. Sure. Yeah. Okay, let's do this. And